the #1 reason for slow knee replacement recovery. Imagine training for a 220-yard dash without a stopwatch. How do you know if a particular training method works? A stopwatch is an easy way to measure outcomes. Without a stopwatch, athletes and coaches are sunk. In short, no stopwatch, no measured outcomes, no feedback loop, no success. And this is where so many struggling with knee replacement recovery go wrong. Patients need a stopwatch for knee replacement training because outcomes and feedback loops are critical for any successful endeavor. The type of measurement needed in knee replacement recovery is relative improvement in knee range of motion available with every session. Accurate outcomes will alert you when work has been hard enough to make progress and when it has not, allowing for course corrections that save valuable time and effort. It will also yield critical information about overtraining. This process is widely known as a feedback loop, the importance of which needs no outside endorsement. It does, however, need to be adequately applied to the challenge of rehabilitation after a total knee. Traditionally, feedback is intermittent, in the form of a physical therapist using a device called a goniometer to measure knee range of motion. This feedback might be daily at first, then drops to several times a week. In other words, the average patient is in the dark, trying to determine whether each session is effective. Patients might have some vague sense that they are better one day to the next, as noted by the stiffness in their knee, but no hard, fast evidence. The No Days to Waste 7-point stretching program includes measurement techniques that can be easily taken by the patient without the need for a therapist. Patients see visual progress towards goals and get re-energized to obtain them. Conversely, when they start to deviate from the program and lose traction, they are instantly alerted to the lack of progress. No more wasting days of recovery on poor technique and ineffective exercise. Patients come to trust the system as they witness range of motion improve at a predictable 2 to 3 degrees per day. The feedback loop is also invaluable in driving home the need for an exercise frequency of 4 times a day, a recommendation endorsed by the No Days to Waste program if maximal progress is to be achieved. As the length of time between sessions extend beyond 3 to 4 hours, patients have to work all that much harder in the next session just to get back to baseline. They quickly realize that this is ultimately self-defeating. Working at a level that is insufficient to achieve steady progress is a common error. In fact, without accurate measurement, you will work below your potential every time. With the No Days to Waste program, the guesswork is removed and steady progress maintained. No more overconfidence, cutting corners, or wasted efforts. See you in the next video, where you will learn about all types of leverage.